My son Brandon will be 28 next month. He's stable. His diagnosis with sickle cell was pretty devastating, and for the first 10 years of his life we had lots of battles. And it's because of that first 10 years he's still living with lots of debility. But since about the age of 18, he's been very stable. He's had some really innovative surgeries, as well as getting onto a stable dose of hydroxyurea with supplemental blood transfusions. And since about 5-6 years, he's been very stable. I recently launched a blog in sickle cell disease. It's entitled Innovative and Compassionate Solutions for Sickle Cell Disease. You can find it at Sickle Cell Disease Advocate, or scdadvocate.com. And on that you can find information about me, as well as what's happening in the world of drug development for sickle cell disease. So I blog about some of my patient advocacy work behind the scenes. For instance, I wrote to the then Commissioner of the FDA, Ms. Hamburg, about the Priority Review Voucher program being applied to sickle cell disease. I also blog about some of the personal experiences I've gone through and the diagnosis of my son. In fact, that particular post is entitled, "Does a double negative make it positive?" So see that post to understand what I mean by that. And I also blog about just what are the best practices that are out there with respect to rare disease communities, so we can get the kind of assistance that comes when you have commercial interests that are involved in rare diseases.